Full to see so many of you here, especially of our frontline providers, doctors, nurses, and healthcare workers. We're absolutely honored to host this event and to share in this very special announcement that we will have a lasting impact on our hospital and the hundreds of babies we serve each year. Before we begin, I'd like to acknowledge our guests whose support and partnership are essential in bringing today's announcement to life. Thank you to Deputy Premier and Minister of Health Sylvia Jones, Minister of Sport and MPP for Hamilton East Stony Creek, Neil Lumsden, and MPP Donna Skelly for Flamborough Glanbrook. Without their support, this would not have happened today. Your presence is a testament to the priority you place on St. Joe's and the care needs of our community. St. Joe's, as many of you know, is also an academic health science center, teaching hospital affiliated with the Faculty of Health Sciences. And I want to welcome Dr. Barry Lum, the Vice Dean, who has also been supportive of these efforts. So without further ado, I want to welcome Minister Sylvia Jones to share today's exciting news.
Well, thank you very much, Mike. It really is a pleasure to be able to be back here at St. Joe's Hamilton, and after we had a visit last month with Premier Ford alongside my colleagues, your local MPPs, Minister Lumsden and Donna Skelly, and I have to say, you know, the conversations that we've had about what happens at St. Joe's and how investments need to happen at St. Joe's is really about your two champions. So thank you, Donna and Neil. And today's project, we are continuing to build a more connected and convenient healthcare system across Ontario. On behalf of Premier Ford and our entire government, I want to thank Mike and your entire team at St. Joe's for hosting us today, and for everything you do to provide exceptional patient care for Ontario families each and every day. Under the leadership of Premier Ford, our government is making record investments in healthcare to provide more people at every stage of life with the right care in the right place. I've had the opportunity to travel across Ontario and see firsthand progress that our government has been making, taking bold and innovative action to make it easier and faster to connect to you to the care you need closer to home. We are getting shovels in the ground for over 50 hospital development projects. In the Hamilton region and in partnership with St. Joe's, we are building the new 57-bed reactivation care centre that will create more seamless transitions for patients from hospitals to their community care providers. The province will invest more than $16 million to build the new reactivation care centre in Hamilton. Congratulations. Once opened, this new facility will include 57 transitional care beds, so desperately needed in our community. We are making historic investments to expand access to primary care, with the goal of connecting every Ontarian to a primary care provider in the next 5 years. This past summer, our government announced 14,000 more people throughout the Hamilton region will be connected to primary care. This is in addition to the 14 new undergraduate and 50 new residency positions our government has added right here at McMaster Medical School. Our government is also expanding access to key services like fertility treatment and pediatric care. We are investing $150 million over 2 years to triple the number of growing families able to access government-funded fertility services in their community through the Ontario Fertility Program. And through our record investment in pediatric care, we have completely transformed the way pediatric care is accessed and experienced by children and their families in Hamilton through the establishment of a new pediatric ambulatory clinic right here at St. Joe's Hospital. And by increasing access to services like surgeries, emergency, and mental health care at McMaster's Children's Hospital, our government is not stopping there. Today, I am pleased to announce that our government continues to build on our progress to connect more families to the care they need closer to home by building a new special care nursery here at St. Joe's Healthcare Hamilton. This does not happen without advocates, without people like Mike and your team, your two amazing MPPs, Donna and Neil, talking about the needs and showing where we can make a difference. The current special care nursery will be renovated to ensure newborns and their families have better access to family-centered neonatal intensive care and birthing supports, including more private rooms, more space for care, and supports tailored to the early developmental needs of our infants. Through our government's investment in the redevelopment of St. Joe's Special Care Nursery, we are not just expanding a facility. We are giving families in the Hamilton region comfort and hope during a critical time, knowing their newborn, their tiniest patients, are receiving the highest quality of care where and when they need it. St. Joe's Hamilton does incredible work caring for little ones and their families when they are most vulnerable, so they can grow, thrive, and become healthy and happy children. Thank you again to the team here at St. Joe's Hamilton for the tremendous care you provide to patients and families each and every day. It's now my pleasure to turn the podium over to MPP Donna Skelly.
Thank you, Minister, and it's always such a delight to be here at St. Joe's. I've said this before, but St. Joe's has a really special place in my heart. As a former journalist, I covered many amazing stories of the folks and the patients and the work that you do here at St. Joe's. That was prior to getting into politics and prior to becoming a mom. Both my boys were born here at St. Joe's. One of them ended up in the neonatal unit and received exceptional care. And of course, having two boys and living close by, I spent an awful lot of time in the emergency room department, where we also received exceptional care. I am absolutely delighted to be back here at St. Joe's. We seem to have spent a little bit of time here over the course of the summer, and I actually had a chance to speak with Mike and the staff earlier this summer to talk about the project that we announced today, and I'm delighted. I absolutely adore the people who work here and am so proud to be part of a community that can celebrate the work from the people that work at St. Joe's. You truly do take care of our most vulnerable, and you position Hamilton as a leader in healthcare, not just in the province of Ontario, but globally. Thank you to all of you, Mike, the staff, but more importantly, the frontline workers, who, as I've said, have taken care of my family and who continue to take care of our most vulnerable. And I am so proud to be part of a government that recognizes the work you do and will support the work you do. Thank you all.
Thank you, MPP Skelly. Before I introduce our next speaker, I want to express our sincere thanks to MPP Skelly, MPP Lumsden, and the Minister, as they've highlighted today. They just don't go from their constituency offices to Queen's Park. They've taken the time to understand who we are and visit often. They take our phone calls when they're needed. And I see our board chair in the back bar, Baudouin, has joined us today. So on behalf of our community, these are very active, caring MPPs who look out for us, and that's how today's announcement got to be here today. So thank you very much as our elected representatives. I'd now like to introduce Dr. Angelo Mikrogianakis. I'm going to pronounce it wrong, Angelo. I even practiced. So you're going to educate us on how to pronounce your last name. But he's the Chief of Pediatrics at St. Joe's and McMaster Children's Hospital. He'll bring greetings on behalf of the program.
Thank you, Mike. Good morning, everyone. What an absolute honor and privilege it is to be here today. When I came through this unit in 2018 on my recruitment tour to take on the role as Chair and Chief of Pediatrics, I met people with passion who cared and really wanted the best for the patients and families they served. And I'm actually touched today to be here to finally deliver on that long-standing wish, not for themselves, for our staff and our physicians, but for the families and the community that they serve. And looking at you all and seeing you come out today is really a touching experience for me that I want to thank all our staff and our faculty, as well as everyone who helped make this happen today. That was off script and from the heart. Now we're going to get back on script. My name is Dr. Angelo Mikrogianakis. I am the citywide chief of pediatrics here in Hamilton and the proud chief of pediatrics here at St. Joe's Healthcare Hamilton. I am honored to stand before you today on this special day for this special announcement as our staff and committed people wear their World Prematurity t-shirts, and the coincidence doesn't go unnoticed or doesn't seem like it's a special message from above as we approach World Prematurity Day to be here celebrating. On behalf of the NICU team, I want to thank Minister Jones and everyone involved in making this investment into our neonatal intensive care unit a reality. This support is invaluable for the tiny patients and their families who rely on the compassionate, round-the-clock care provided by our dedicated healthcare workers here at St. Joe's. For families, every day in the NICU is a set of challenges. Those challenges are overcome by the many caring hearts that are filled with hope and love. This announcement will allow us to create a facility that supports growth, development, healing, and family-centered care. Families will have access to state-of-the-art facilities, equipment, and the wonderful care that comes from our staff and workers. It is these kinds of compassionate improvements that give families the best possible start to life and support regional clinical care over the long term. Today is an important reminder of the dedication of our NICU staff. They each bring extraordinary skill and resilience to deliver expert care to these tiny patients, and their commitment is nothing short of inspiring. This investment in the NICU is an investment in your work, making it easier for you to continue delivering the exceptional care that you are known for. The NICU is a lifeline for families during some of the most critical times in their lives. Each story from the NICU reminds us why this work is so vital. And today, we are fortunate to have one of our special families who have experienced firsthand the care and compassion of our NICU team. I'll hand things back to Mike to introduce our special family. Thank you.
As Angelo has noted, we're just not St. Joseph's Healthcare Hamilton. We are the ones who have been entrusted with the mission of the sisters. And the sisters always remind us behind a building and behind the technology is a family that you need to take care of. So please welcome Lauren and Gideon St. Pierre, who will share their experience with St. Joe's.
Hey. Good morning. Yeah, I'm Lauren. It's my husband, Gideon. Our daughter, Annie, was born prematurely at 33 weeks about a month ago, very suddenly by emergency C-section. And yeah, she came early, so that was a surprise. And then all of a sudden, we're not just parents, but now we're NICU parents, and you're thrust into a whole other world that has a lot of challenges and a lot of scary moments, and you're just not sure what's going on. But I will say we've had above and beyond amazing care, especially by the nurses and all of the doctors and staff at St. Joe's. Yeah, we've just been so blessed with people who go the next step to, you know, make her little crafts and take her footprints and just show that they really care. So we have been so supported and loved by them. They've seen me cry sitting by Annie's bed so many times. They always have that tissue box ready for me. But yeah, so we're just so thrilled for St. Joe's to have a new facility. I mean, just being able to have private rooms where you're not overhearing everybody's information, and you know, when I'm sitting there sobbing, the whole room can see me. So that will be wonderful. I remember very early on with Annie, one of the nurses said, "Oh, just don't mind the wires here. We don't have our new unit yet." So I know this has been long awaited. We're so thrilled for them and so thankful for everything St. Joe's has done for us. And we're just celebrating today. And Annie's celebrating too. She got her CPAP off today. She's been on that a month. So she knew today was a big day. So we're all excited. So thank you so much and congratulations, St. Joe's.
Once again, thank you to Premier Ford. I think he might have been calling Minister. I'm not too sure, but if he did, we just wanted to say thank you to him and to all of you. I'm going to hand it now over to our colleagues from the Ministry of Health who are going to facilitate some media inquiries, I believe.
We're now going to start the media QA portion. As a reminder, the format is one question, one follow-up.
Hi, Eric Viano, CHCH News. I just want to ask about a recent report from QB. It says there's been an increase in hospital staffing capacity issues in the province, including here in Hamilton, and they say that the provincial funding isn't enough. I just want to get your response to that concern.
You know, we've always been very focused on ensuring that our hospital partners have the funds that they need to continue to provide the exceptional service. We'll continue to do that as we go through our process, as the hospitals go through their first, second, and third system feedback in terms of how they are doing on their budgets. We will be there as we always have been. You know, it's not only about making investments and increasing capacity, but it's also ensuring that we have the human resources, for example, to make sure that we have people who are willing to work and wanting to work in these systems. And I think of some of the work that McMaster is doing, that Mohawk is doing, expanding the number of opportunities for young people to train as healthcare practitioners. You know, whether it's nurses, nurse practitioners, physicians, we have expanded the number of opportunities in our school system, and we have continuously ensured that our hospital partners have the funds that they need to continue to provide exceptional service.
And I just want to ask, too, at the same time, the St. Joe's Foundation says it's running a lottery to help bridge what it calls critical provincial government funding caps. Why are there multiple concerns about provincial funding for hospitals?
So I want to be clear, our hospital foundations across Ontario do exceptional work, but it is not for operational dollars. It is to ensure that critical equipment, as we see emerging technologies coming forward, it's actually our hospital foundations, our communities, our donors, our philanthropists who step up and provide those critical equipment pieces. And it has been like that for decades. We see a lot of exciting new technology happening in our healthcare sector, and rightfully so. Hospitals and hospital leaderships want to be part of offering those new pieces of equipment, new technology in their facilities. And that's the critical role that foundations make, that philanthropy makes, that donors make in our communities. And it has been like that for decades. We will ensure operationally that we have and continue to provide the necessary services. But in terms of equipment, that really has been the role of hospital foundations and donors for years.
Next question.
Hi, thank you. I'm Joanna Friketich from the Hamilton Spectator. The hospitals in Hamilton, they're projecting deficits over $130 million. For HHS, it's $112 million, and this is the fourth year in a row they have been in deficit. These hospitals, especially HHS, is now cutting staff and looking at every single program.
I'm sorry, Joanne, they're not cutting staff.
Well, they're cutting vacancies, which is cutting staff. So can you talk about like what you are doing for the hospitals?
I want to be very clear. They are not cutting staff. What the hospital has made a determination that they will not fill non-clinical, non-frontline staff while they work with the ministry, with Regional Ontario Health, to ensure that we and they work together to provide the necessary services. But I want to be very clear. There has been no layoffs and no intention to lay off frontline patient-facing front staff.
And Hamilton home care patients have been utterly devastated by the shortages that have occurred in supplies since the changes in September. Can you talk about, how that happened, what is being done to fix that, and who's being held accountable for that?
Absolutely. So I said right from the very beginning that it is absolutely unacceptable for individuals who are recovering in their own home, in their own community, to have any kind of disruption in their medical supplies or their medical drugs. We have ensured that these vendors who are struggling now have and have had for many weeks support of individuals who have come into those vendors to make sure that people are getting the supplies that they need. We are seeing that there has been a great improvements, but that is no excuse for the fact that we need to make sure this never happens again. And we are ensuring, working with that one vendor in particular, that they understand and are getting the supplies they need. I've made it very clear, we cannot have people at home who are not getting their medical supplies necessary. The work that we have been doing with Ontario Health and Home is specifically to ensure just that. And I directed Ontario Health at Home many weeks ago to ensure that individuals who were going out and purchasing those medical supplies would get reimbursed through a process. That has been set up for a number of weeks, and we are seeing that those reimbursements are coming within 48 hours to 3 days.
That concludes our availability. Thank you.
Thank you, everyone.